I'd like to introduce our next speaker. Her name is Robin Forbes. I first met Robin 18 years ago. She was my genetic counsellor when I walked into her room with my baby Montana, and she has been a fantastic support to me and SMA ever since. Today, she's here talking about the patient registry and why you should be on it, why should you be involved, and what you need to do to be able to do that. So welcome along, Robin. She's here in person today, and thank you very much for coming.
Thank you, Julie. So congratulations, Julie. It's been an incredible achievement, and you should stand tall over what you've achieved in the last 18 years. As Julie said, I'm a genetic counsellor at the Royal Children's Hospital, but I'm speaking to you at the moment as the coordinator of the Australian Neuromuscular Disease Registry. And as Julie said, things change over time, and we realised a few years ago that we needed to be able to help the SMA community in their advocacy. And we reinvigorated the Australian Neuromuscular Disease Registry, which is now based at the Children's Hospital and the Murdoch Institute here in Melbourne. So obviously what I'm talking to you about today is the Australian SMA Registry, and we're really proud to be a part of this registry and what we've achieved on the registry in the last 2.5 years. So what is the Australian SMA Registry? Well, this is a busy slide, and I do apologise for that, but there are some important messages to take away from this slide. The first is that HREC number, and that means that we have ethics approval and we are scrutinised for about the information that we collect. So we just can't go around asking random questions about SMA. We have to have a reason for asking the questions that we ask on the registry. The information is confidential, and I want to stress that. And we have to report back to ethics about what we are doing and that we are achieving what we say that we were going to achieve with this registry. We are part of the Treat NMD Global Registries Alliance, and I think this is one of the best partnerships we could have engaged with. This means that we are asking the same questions on the Australian registry as they are asking on the Canadian registry, on the New Zealand registry, on some registries in the States and in Europe. And this means that we can gather anonymised, de-identified information regarding SMA very quickly and very accurately. But more importantly, that we know what is going on in Australia, that we have information that is local and relevant to the type of care that we can offer and give in Australia. The slide on the right is just an overview of how the registry runs, and last week we were excited to add about 5 more neuromuscular conditions to the registry. So the registry is growing and has grown very quickly in the last 2.5 years. The SMA registry, I think, is an incredibly important part because, as been alluded to already, treatments for SMA are certainly leading the way with other neuromuscular conditions that have potential treatments coming on board. And we've learned a lot in this journey in the last 2.5 years. We have an advisory subcommittee who advise us on the SMA registry as well. The way the registry works is we do receive funding from pharma, but we also have philanthropic funding support that you can see along the bottom of the slides here. And with Treat NMD, the registry do get reimbursement. If we have an inquiry, they may ask us a particular question about the number of patients that might have 3 copies of SMN2, for example. I won't get too caught up in explaining that. And then we are reimbursed for that. But no personal information is ever given. We just give aggregate data, and I will give an example of that shortly. So why the SMA registry? What made some very busy people want to take on more work? So as Julie said, I'm a genetic counsellor in the neuromuscular clinic at the Children's Hospital here in Melbourne. That is a full-time job in itself. We look after more than 500 children in that clinic with neuromuscular conditions. But we felt it was important to push for this registry so that we could help the families that we see in clinic every week. And part of this was that there is a new SMA. So traditionally, I think most of this audience will know that there's type 1, type 2, type 3 SMA, who used to be classified as babies with type 1 would never sit, children with type 2 would sit but not walk, and type 3 walked. But we know that with the advent of treatment, we need to learn very quickly about the new type of SMAs. Those definitions don't fit anymore. And we need to learn about the natural history over time. We used to be able to prognosticate what happened if a diagnosis of SMA was made. Now that is a totally different story with the advent of treatment. So we need to learn what happens with the good care that can be offered in the clinical services with physiotherapy and so on, but how the new SMA progresses over time. And so we can answer questions. How do we now best monitor what I'm going to call this new SMA? And we're learning that as we go as well, and learning from the literature. And how can we best care for people with SMA and for families that have SMA diagnosed in their child or their baby? So why the registry? And I think the obvious answer is that new disease-modifying therapies require high-quality data. And the good quality data informs both the initiation of treatments and the continuations of therapy. And I'm really excited that I think an example of that was the announcement that was made on Friday with access for adults to treatment. And the registry did play a role in that, which I'm very proud of. So the SMA registry, we would like everyone with SMA to at least consider being on the registry. We have paediatric and adult patients from all over Australia. And we know it's a lot of hard work. So Anna O'Malley, who runs the SMA registry with the data collection, contacts families and individuals every 6 months to update the information. And we know this can be onerous, but it is incredibly important. And we are collecting robust, validated longitudinal data. And that means that the information that we're collecting has been verified in the medical literature and in publications, and that the registries are collecting this all around the world. And longitudinal data means that we're collecting this data over a period of time, and that's incredibly important, that we learn as these treatments are going to be used across the board. So why do we want you to consider registering? So I think the last few years have shown that there is a very rapidly changing needs for the SMA community. So we can respond with real-world data and real-world evidence. And these are the questions that we're being asked. And we can answer this for our Australian families. And good quality data is essential for regulatory requirements. And I think that's been shown. We've been asked to the feedback table a couple of times, and government are engaging us with potential therapies for other conditions, because the registry has been used to help with regulation for SMA treatments. The registry is a good way of capturing natural history and new natural history. So my role in the clinical service, I know what happens to our children and our families in the paediatric setting, but I have no idea what happens once we transition our young adults to adult services. And the registry is a good way of following up with this and learning about this. And we need to be able to measure the effectiveness of the interventions. And by that, I mean not only the medical treatment that has become available, the drugs and the disease-modifying therapies, but also the use of physiotherapy and other support services that we know continue to be important in the care of individuals with SMA. And I think the registry can also inform standards of care. And by that I mean, are there physiotherapy services in the adult community? There are certain standards of care that we think that individuals with SMA should be able to receive and have access to. But is this available? And the registry data can help facilitate that in the community. So registry fatigue is a big one. We know that families are busy if they're going to appointments, that their real life is happening outside the clinical rooms, and then we bug you every 6 months for the data. Sometimes the easiest thing is to say, I want to come off the registry. And every time we speak with you, we will always check that you still want to remain on the registry. But we know it's a lot of work. We really appreciate what the families and the individuals put into this. And I would encourage you to please consider staying on the registry when we start hounding you. So this is how we look at the data. This is what we're doing. So when I put this slide together, we had 160 individuals on the registry, and you can see there that the orange colour is our paediatric patients and the blue is our adult over the 19 years of age on the registry. So there are 160 individuals on the registry with genetically confirmed SMA, which is important, and that we have actually got data on the registry. And then there's another 22 individuals who've recently contacted the registry, and we're in the process of adding them to the registry. So we're quite excited by those numbers. Well, of course, I'd always like it to be more. So an example of collecting the data and informing us and how we can help advocate. So one of the questions that you'll be asked is who you've seen in the last 6 months. And we can see that children see their neurologist quite frequently in the previous 6 months. And in the paediatric setting, we have a multidisciplinary clinic. And that means that often there are the neurologists, the physios, the OTs, the dietitians, the orthopaedic surgeons, the genetic counsellor in a multidisciplinary clinic. So there are many specialists. We can see there in the adult setting that that doesn't happen. Only 9 individuals have been seen in a multidisciplinary clinic. We can use this registry data to hopefully help adult services to lobby for these sorts of support, and that we can help lobby government. More adults see their GPs, and again, physiotherapists, adults aren't seeing their physiotherapists as often as paediatric patients. But adults are more likely to see rehab specialists and see other types of specialists as well. That was an even split. This is how we look at data. And when we say it's aggregate data, this is an example of aggregate data. It's not your personal information that's looked at. We look at it as a whole. It's de-identified. We can also look at the types of outcome measures, and these are incredibly important, especially with the advent of disease-modifying therapies, of the different types of physiotherapy that is available for children and for adults here. And we can see that most of the information up until now has been on paediatric outcome measures, but the adult accurate SMA outcome measures are being developed and enhanced with the advents of treatment. So I think the Australian Neuromuscular Disease Registry can inform the new neuromuscular disease trajectory. Things are changing very rapidly in the neuromuscular disease arena. And it's been shown that high quality, reliable data is really essential, especially with the new disease-modifying therapies that are now becoming available. This is really an exciting time in the neuromuscular area. We can help identify potential outcome variations of treatment or treatments. So when different treatments are trialled, it's in a clinical trial setting. We are collecting real world data. So what happens when this is outside a clinical trial? And we can respond with rapid updates as this data becomes available. I think the registry forms an important role in informing the scientific, the clinical and the health policy communities, and we should be used in that way. And the registry is a powerful tool to observe the course of different neuromuscular conditions, of monitoring outside the clinical trial setting. So we see the registry as a phase 4 part of clinical trials. It's an important research tool moving forward, and it's going to inform the standards of care, and I think it's exciting to say the new standards of care. And the most important thing is that we can support patient advocacy, and we're proud to be able to do that. So if you go onto the registry web page, and I'll give you those details in the next slide, this is what the registry web page looks like. And you can register your interest by hitting either of those 2 buttons. And all you need to do is give us your email address or a phone number, and we will contact you. Your doctor doesn't have to notify us. We are happy for you to contact us directly. Anna will give you a call, and then we'll take it from there. If you choose not to go on the registry, that is absolutely fine, but at least discuss it with us and find out about it. So these are our contact details. This is our phone number, our email, and the registry web page at the end. Thank you very much.